Metabolic effects of antihypertensives include A. Changes in electrolyte levels, B. Changes in lipid levels, C. Changes in glycemic control, D. All of the above. Correct answer D. All of the above. Metabolic consequences of antihypertensives include effects on electrolytes, lipid levels, uric acid, and glycemic status. Atrioesophageal fistula is a potential complication of A. AV-NRT ablation, B. AV-RT ablation, C. Pulmonary vein isolation, D. RVOT-VT ablation. Correct answer C. Pulmonary vein isolation. Atrioesophageal fistula is one of the dreaded complications of pulmonary vein isolation. It occurs due to thermal damage to the esophagus, which lies adjacent to the left atrium. Thermal sensors in the esophagus are useful in preventing this complication. Sick sinus syndrome in post-op CHD occurs most often in A. Fontan and Glenn, B. TOF repair, C. Arterial switch, D. None of the above. Correct answer A. Fontan and Glenn. Type 2 truncus arteriosus. A common pulmonary trunk arises from the truncus arteriosus and divides into left and right pulmonary arteries. B. Two pulmonary arteries arise separately but adjacent to each other from the truncus. C. Two pulmonary arteries arise separately from either side of the truncus. D. Pulmonary atresia. Correct answer B. Two pulmonary arteries arise separately but adjacent to each other from the truncus. Anti-ischemic mechanism of action of ranolazine is by A. Negative inotropic effect, B. Positive inotropic effect, C. Negative lusitropic effect, D. Positive lusitropic effect. Correct answer D. Positive lusitropic effect. Ranolazine is thought to have its anti-anginal action by preserving myocardial blood flow during ischemia by its effect on inhibition of late sodium current, which in turn prevents cellular sodium overload and sequentially calcium overload. Prevention of calcium overload reduces compression of intramyocardial blood vessels by reducing diastolic myocardial stiffness. Usually, the late sodium channels remain open during myocardial ischemia, leading to intracellular sodium overload. This extra sodium is extruded by the sodium-calcium exchange mechanism, which leads to calcium overload. Calcium overload causes diastolic relaxation failure as the increased calcium ions cause increased tension in contractile elements of the myocyte. Thus, the anti-anginal effect of ranolazine is mediated by a positive lusitropic effect in myocardial ischemia, which resets the vicious cycle of ischemia begets ischemia. Lusitropy is the property of diastolic relaxation, while inotropy is the property of systolic contraction. According to universal definition of myocardial infarction, type 5 myocardial infarction is A. Myocardial infarction secondary to plaque rupture, B. Myocardial infarction secondary to hypotension, C. Myocardial infarction due to stent thrombosis, D. Myocardial infarction associated with coronary artery bypass grafting. Correct answer D. Myocardial infarction associated with coronary artery bypass grafting. Which of the following is not a measure of ventricular repolarization? A. QT dispersion, B. T wave width, C. QRST angle, D. QRS width. Correct answer D. QRS width. Following parameters have been used as electrocardiographic measures of ventricular repolarization. 1. QT variation between different ECG leads, QT dispersion. T peak to T end interval, TPTE. 3. T wave width. 4. Spatial angle between QRS and T vectors. Hydration prior to contrast angiography is useful to A. Reduce the chance of contrast nephropathy, B. Reduce the chance of thrombotic episodes in cyanotics, C. Reduce the chance of pulmonary edema, D. A and B are true. Correct answer D. A and B are true. Good hydration prior to contrast angiography is useful in reducing the chance of contrast-induced nephropathy, as dehydration which occurs due to osmotic diuresis after contrast angiography can predispose to thrombotic episodes in those with cyanotic congenital heart diseases with polycythemia. Adequate prehydration is mandatory in those individuals. In those with severe left ventricular dysfunction, care has to be taken to avoid pulmonary edema while hydrating. Hepatoclavicular view is A. LiO40 cranial 40, B. RiO40 caudal 40, C. LiO40 caudal 40, D. RiO40 cranial 40. Correct answer A. LiO40 cranial 40. Hepatoclavicular view for angiocardiography is named so to describe the direction of the X-ray beam from liver below to the left clavicle above. It is a shallower long axial oblique view with steeper cranial angulation. This view images the posterior aspect of the ventricular septum in the atrioventricular canal region. The common AV valve can be visualized angiographically in this view. This view is also called the four-chambered view, as both atria and ventricles are seen in four quadrants of this angiographic view. Valvular regurgitation, LVRA, left ventricle to right atrium, shunt, and overriding or atresia of AV valves can be recognized in this view. Myocardial performance index is A. Ratio of end diastolic volume to end systolic volume, B. Ratio of stroke volume to end diastolic volume, C. Ratio of the time spent in isovolumetric activity to ventricular ejection, D. Ratio of time spent in systole to time spent in diastole. Correct answer C. Ratio of the time spent in isovolumetric activity to ventricular ejection. MPI is equal to ICT plus IRT divided by ET. ICT, isovolumic contraction time, IRT, isovolumic relaxation time, ET, ejection time. Change in systolic pressure with IABP in augmented beats. A. Falls by 10%, B. Rises by 15%, C. No change, D. Biphasic response. Correct answer A. Falls by 10%. During intra-aortic balloon pump or IABP, a balloon kept in the descending aorta is inflated during diastole and deflated during systole. Hence, the augmented diastolic pressure is above the systolic pressure generated by the failing left ventricle. Systolic pressure of augmented beats is lower than that of non-augmented beats because the left ventricle pumps into an aorta which is virtually empty on deflation of the balloon. De Vega's annuloplasty is commonly used for A. Mitral valve, B. Tricuspid valve, C. Aortic valve, D. Pulmonary valve. Correct answer B. Tricuspid valve. In this procedure, De Vega's annuloplasty ring is sewn at the tricuspid annulus to reduce its dimensions and thereby reducing the leak, which occurs mostly because the valve leaflets do not touch each other when the enlarged right ventricle contracts.